ever wondered how a doctor actually decides whether a condition is related to military service? It's not guesswork. Doctors use a process called clinical reasoning. This is something that clinical reasoning is a process of reviewing a patient's history, evaluating symptoms, and considering all the possible causes, aggravating factors, and we're applying medical knowledge to reach that conclusion. So when we evaluate whether a condition is related to service, there are several factors that are considered. And every case is unique. It's not a one-size-fits-all. Every veteran has different risk factors, and we need to consider how those impact the condition independently. One of the most important factors is the timeline. So when did the symptoms start? Did they begin during service or after a specific event? Timing can provide some important clues. Another factor that we consider is the symptom pattern. Do the symptoms match what we know about that condition? Are they consistent over time? Medical providers also consider known medical relationships. This means looking at whether that medical research or clinical experience supports the connection and how it supports the connection. So it could be very vague and difficult, especially if you're looking at exposures, because there could be many unknown factors at play, because research is not quite up to speed on what that exposure can do to the body. Another key concept is the differential diagnosis. This means considering multiple possible causes of a condition and determining which is most likely. So, for example, you have a veteran with a back pain condition. The provider may consider injury, degenerative age changes, nerve involvement, or other causes. The goal is to determine which explanation best fits the evidence. And you may have multiple positive associations, and then you have to figure out which one is contributing more. How much is one contributing to that condition? This is why medical opinions are not just yes or no answers. It's an explanation based on evidence and reasoning. The VA relies heavily on this type of reasoning. They're not just looking at conclusions. They're looking at those conclusions and how were those conclusions reached. So the key takeaway here is doctors don't simply state whether a condition is related to service. That's very superficial. We have to dig deeper and go to other levels. They have to explain how they arrived at that conclusion and what other conditions or outside factors are playing a role, how impactful are those factors, and in this veteran's case, and what does the research show? The important question for veteran is whether that reasoning is clearly documented in their records. If not, a nexus letter may help uncover those connections.